Hello, everyone, and welcome to the webinar. Today's topic is strengthening patient engagement in NextGen Office through telehealth, virtual visits. We have two guest speakers, Gary Wietecha, commonly known as Dr. Gary. He's the clinical liaison for primary care, and he's going to be discussing clinical documentation and properly coding the virtual visits. And then we have Jason Parke, who's the Senior Sales Specialist for NextGen Healthcare, and he'll be demonstrating the eVisits platform in NextGen Office. A couple housekeeping rules. If you ask questions, you can ask them in the comments or in the Q&A down in the bottom. We'll get them answered at the end of the discussion online. And then we'll also make this presentation available in a follow-up email in a few days along with the slides for your review or to share with colleagues or coworkers. And with that, I'm going to turn it over to Dr. Gary.
Great. Hi, everybody. Dr. Gary here. And thank you for taking some time away from your busy day to hear about what we have to say and about our product for virtual visits. So let me get this moving. So this is me, and I have a lot of roles at NextGen, but I am an OBGYN by education and training, and I'm going to be going over all this telehealth stuff and then show you some of the documentation, things that you should keep in mind as you're documenting a telehealth visit. And then my friend Jason is going to then give a demo of our telehealth solution within the NGO product. And he'll give you a walkthrough of that. So let's get started. Some things to keep in mind as we're going through this. First of all, I should have a caveat to say this stuff that I'm talking about is true as of yesterday. And I say that because, as you are probably aware, so many things are shifting right now in our industry. With everything that's happening with COVID-19, you know, the government is changing things, both the federal and the local or state governments. So I'm giving you what it is now. We will be doing updates. Also to let you know that, yeah, we will have this presentation go out, but there will also be knowledge articles online so that you could download that, which will have a lot more information than what you're seeing here. I only get 20 minutes or so to give you a high overview. But, you know, in the past, doing virtual healthcare or virtual visits was a convenience and a choice. And with today's crisis in place, this COVID pandemic, it is becoming the norm for our clients, for providers around the country, or actually around the world. And a lot of the payers have relaxed or they have changed their view on this. They're actually removing barriers within their worlds to make it possible for providers to use this as an alternate form of patient engagement. I also think, though, that once things are back to quote-unquote whatever that new normal is, patients are going to demand this. They're going to want this. So getting good at this now, keeping it for the long term, I think telehealth, telemedicine is here to stay. So just to go over, we're going to go over to telehealth. I'm going to talk about some of the codes that you need to use for telehealth. I'm also going to give information about COVID-19 documentation, just so that you can keep that in mind as you're working with any patients that are coming in now or may be coming into the future, depending on where you live in your environment. And then Jason will give a demo and an overview and a presentation of the solution we have. So, as you all know, you've heard it on the news, you've seen it at your local, groups and things like that. We're going to focus in on Medicare and Medicaid services, but this is also applying to our private payers. They have broadened access to Medicare or telehealth services, and they have changed their policies as a part of the President's emergency declaration to give a little more flexibility. And the reason they're doing this, of course, is to provide access to care in the community to contain that spread or the community spread of the virus. So they're allowing for telehealth visits as an alternative to in-office, in-person visits. And it's also keeping you, the staff, safe so that you're not having to either be exposed to the virus yourself or bringing those patients in to be with your other patients. It also allows patients who may be at risk, or all of your other patients, you know, to do this from another location and not be exposed to the virus. So as all of this started March 6th of last month, about a month ago, and Medicare is paying office, hospital, and other visits to be really given over telehealth. And this now has been expanded out to be places of residence. This is going to also allow other provider types, I'll give you a list of that in a few minutes, who will be able to offer telehealth to their patients. One thing that's very important to realize is that these virtual visits or telehealth visits are considered the same as in-person visits, and they are going to be paid at the same rate as your regular in-person visits. When I say that, earlier this week you may have heard that Medicare has relaxed their or loosened up the documentation requirements. That may be something they said, however, they didn't define what they mean by relax. And if you've been in the industry for a while, you know that what they say today may change a year from now. They are going to be looking for people that have gone fraudulent on this. So our recommendation as a best practice is that you document your visits at the same level that you are doing today for an inpatient, that you document your telehealth visits the same way. For clarity, I'm going to talk about 3 different types of virtual services. And the reason I bring this up is because there's a little bit of confusion. The one that we are talking about today and the one that Jason is going to be showing is the Medicare telehealth visit. I'm calling it that because we're gearing this towards Medicare, but other payers are allowing this as well. The other 2 you may have been doing already, so I just want to bring them to the forefront. But I want to clarify that what we really are advising and giving as the best practice for you today in this environment is to be doing those telehealth visits. So let's talk telehealth visits for a minute. What this is it's an interactive, real-time visit between a provider or staff member. Usually we're talking about providers here, but it is allow that two-way communication in real time. In the past, they required that you could only do this in certain locations, but they have taken that down. Patients could be located anywhere. Another thing that was in the past is that they said that telehealth visits had to be with a patient that you had a prior established relationship with. At this point, that rule has been relaxed, and any patient that comes to you can be seen via telehealth. So you can be doing new patient visits via telehealth. Some of the other things that have changed with these rulings, I already mentioned it once or twice, is location. There were limitations in the past where, what would be a telehealth visit, where the patient could be. The thing now is that the location is anywhere, and the patient could be wherever they happen to be, home, they may be in a facility, but what it's doing is now allowing patients to be calling you and doing a telehealth visit from home. The other thing to remember is that whatever that policy, if you were going to nursing homes in the past, you could do a telehealth nursing home visit and you'd be paid what you got paid before. So those policies, that still change, they're still in place. So that's not changing. You just have to document at the level by which you were documenting in the past when you were moving around to see your patients. What are eligible? Pretty much, and I'm giving an example here, the office visit, but whatever was eligible is now, those office services and other visit services that you had before, they are currently eligible under this new policy. So if you could do a visit with a patient, you can now bring it into telehealth, and you're going to still be using the same codes that you used before. Example would be your office visit codes you would be billing at the same level. You would be documenting at that same level. This is a list of eligible providers that could be doing telehealth. What's really important is that they've added the telehealth capability for FQHCs or rural health communities or health centers during this time period. So if you are one of those types of practices, you now have the ability to do telehealth. It's been expanded a little bit, but other clinical professionals are now able to be doing telehealth visits as well and be able to bill for them accordingly. The big thing about the modality is they used to say that it could only be done on a modality that has both an audio and visual component. So cell phones, or if it was a smartphone or from your computer, you know, they've relaxed that a little bit, but the thing you need to know is that why they relaxed that, they're still expecting a certain level of interaction. And while the Fed said it's relaxed, it's very important for you to go to your state governor's office or other medical agencies to find out what the rules are for where you are currently practicing medicine. Out-of-pocket costs and copays. The thing to remember here is that all of the services that do not apply to COVID-19, so you have a patient for a blood pressure check, UTI symptoms, diabetes check-in, those things will still, you know, the copays and out-of-pocket costs still apply. The one thing that's changed, though, is that the OIG, Office of Inspector General, is providing healthcare providers with flexibility to reduce or waive fees on these other non-COVID services. Just because a lot of people are out of work, people have lost or losing health insurance, so it will allow you to change, you know, some of the fees and what you're charging on that. So anything that was out of the pocket before, even with your Medicare, it still may be able to, those applies, the out-of-pocket costs and copays will be applicable. But the other thing to know is that this is not true for COVID-19. If your patient comes in with COVID-19 symptoms and you send them for testing, that is going to go by whatever the state law or regulations is for handling COVID-19. So you need to get up to speed with your individual state and what they are saying you would be able to do for copays and out-of-pocket costs. The pre-existing relationship, I talked about that, but I want to just strengthen what I said is that the established relationship, which was prior, you know, a requirement, is no longer a requirement during this emergency period. So new patients can be seen. Your initial visit with them can be done via telehealth. If any of you are hospice providers, you will know that there was a check that you had to do on a regular basis. You had to do a face-to-face encounter with the hospice patient to determine their continued eligibility. They are now allowing hospice face-to-face encounters to be done via telehealth. So that is something that is also being done during this emergency period. So I'm just going to bring this up. When you get the slide, you'll see that there is a place for you to find out more. If you are handling Medicaid patients, the thing to keep in mind that Medicaid does allow for telehealth, but you really need to check with your state to find out what they have. A really good place to check is the Center for Connected Health Policy. They have a grid and links there to find out what the actions are by state. So they give a lot of great information there. The other thing to remind you is that HIPAA has also changed in this. They loosened up the requirements for HIPAA, so they're allowing other tools, which is okay. You know, if you have to resort to something else, but you need to also know that you have to check with your state. So the Fed said, you know, you could be relaxed. Your state may not have changed their mind on what their level of HIPAA requirements are. So once again, very important for you to check in with your state agency. Same with private payers. A lot of press out there, a lot of things on the internet about your private insurance or your private insurers and payers allowing for telehealth visits. People are offering it. The big thing to know is that this is still developing and changing. They are coming up with their policies as we speak. It seems every day something's different. It really is important for you to inquire with your payers to see what they will cover from a telehealth perspective. Also recommend that your patients do the same. But since I'm talking to you, the practices and providers, it's something for you to reach out. If you haven't heard from your payers, it's a good thing for you to go out and approach them about this. So that was a telehealth visit. I just want to spend two minutes here on virtual check-ins. You know, while we're mentioning virtual check-ins, you really at this point want to be doing the full telehealth visits. The reason I bring that up is a virtual check-in, you as the provider cannot initiate a virtual check-in. This is a brief communication. The patient reaches out to the provider via many different ways, and you have a little bit of a back and forth, not really real time, but you're doing a back and forth, and it allows for things to be handled, you know, maybe a medication change or whatever, but it really is just a quick back and forth, and as a provider, you're just really not getting a lot of value for you as a provider from these, and you really don't get paid anything for these, but it is something you can do. The thing is, there are two types. There are two HIT-PIC codes out there. If you're doing these already, where you're doing the G2012 or the G2010, you could be doing a brief communication back and forth. The providers are doing these on phones. They're doing it with patient portal. They're doing a number of things, but it really is where you're spending time trying to answer patients' questions, and it's not a quick yes-no, but it becomes a discussion. You need to record that. You need to keep it, and then you can report it and get paid for it. But in this day and age with telehealth, it's probably better to bring them in for, or bring them online for a telehealth visit. The other is if patients are sending you information. A good example is they may send you a picture of a rash and you're doing something, you're evaluating it, or a video. You may then be able to use the G2010. But right now we're recommending that you actually do a telehealth and you do it as a visit, a telehealth visit. The check-in here, or the virtual check-in takeaway, is that patients have to come to you. You can put a sign up in your practice or on your website and say that you'll do virtual check-ins, but your patient has to reach out to you. You cannot reach out to them for this. And if you haven't been doing these already, it really isn't necessary for you to start doing these. We really do recommend a telehealth visit. So e-visits, there is a thing called e-visits, and this is a communication between the patient and their provider through an online patient portal. And e-visits are non-face-to-face, patient-initiated communications with your doctors. And there's a little confusion here, and Jason will go over, show you some of that. But the thing that's important here with an e-visit is the patient initiates a portal communication. It's at a little more intensity than what we talked about with a virtual check-in. The patient's got to consent that they want to do this. And the thing that's important for you to know is that you're really not getting paid very much for these either. And the level that's happening with these, it may be more worthwhile for you to have an actual telehealth visit now and be able to do a full encounter with your patients. Thing to know is that those codes that they have, there are 6 of them, 3 for your providers and 3 for non-independent individuals that will work with patients. Those codes do not give a lot of return on investment, and they take a lot of time to go back and forth. You could do a virtual visit, and the patient will feel that they are being connected with. The other thing is that nothing's changed for these. The e-visits stayed the same from a Medicare perspective as they were in the past. So those are the things there. We're really going to focus in on telehealth. And I just want to go through some of the documentation requirements to set you up for my friend Jason then to give you the rest of this information. So the thing to remember when documenting a telehealth visit, and this is important, the documentation requirements are the same as if you were had that patient 2.5 feet away from you. In-person care. If there is a code, if the coding requires it to be time-based, then you must document, our evidence of the time started, time ended. But the thing that's really important here is that if you exchange anything asynchronously, images or communications, anything related to that also needs to be retained, and that is according to state regulations. And one thing that's really important is that those real-time synchronous videos during the video visit do not need to be stored in the system. So things that you share back and forth need to be stored somewhere. Things that the video itself and that encounter are not being stored, and they do not need to be stored. So let's document a video visit, and I will give you these slides. You'll be getting these out, and there'll be information online. But I want you to keep things in mind. I'm going to go through what is needed for a COVID-19 visit, just because I want to share some of the ICD codes and other things that are required for these visits. But know that you can do a televisit or a video visit, which I call it. You can do these for anything. I'm an OBGYN. My peers are using these for UTI check-ins. They're doing it for follow-ups, chronic condition check-ins, and whatever you can use it for to talk to your patients who are not able to get into the office now because they are, staying at home. You can do a telehealth visit. If you need to physically touch the patient, telehealth is obviously not going to work. So things I want you to know that as you get started with a video visit, first of all, you're going to be using the same template or workflow documents within the system as you always use for an in-person. The thing I can tell you right now from experience and from what my peers have told me, it is weird at first because you feel like you're in a room and your patient is this little vision on your screen, and it just feels alien to most of us. I'm going to tell you this, that you really need to just get in there and start doing them and working with this, and very soon it's going to become second nature to you. And it may be a way for you to transform your practice after this is all over as well, because it's a way to really make things more efficient for your practice. Intake is the first part of this when you're getting to know your patient or what your patient is coming in for. Some people are saying that the intake process is optional, but it's really not all that difficult. As an NGO, NextGen Office customer, client, we have the appointment check-in process, and all the things as you can see there, the verification of pharmacy, medications, allergy, tobacco status, all of that information is gathered with that appointment check-in process, which Jason's going to show you in a few minutes. So it's gathering that information, and the patient will be presented, or you'll be presented with that as you are bringing the patient in through the visit. HPI exposure and history. So this is where I wanted to get into a little bit more of the COVID check, the COVID process. But you can do a COVID check on your patient to make sure that they are, follow up, figure out where you're going to send them to get their testing or where they need to go next. You can do a visit on this. You can use a workflow such as cough or fever or any other HPI that you choose that will give you access to the questions. And Jason's going to show you more on that. But what's really interesting here is that you can get the documentation you need from the patient filling out the complaint form, or you can also do your free text, or you can dictate into the NGO system the parameters that you need for HPI and for the exposure history. It's really important that you capture a level or a sense of the exposure history just so that you can document why this patient feels they may have COVID. It will help you to support why you're sending patients to the next step of their healthcare process as well. This is the component of a document for a COVID-19 assessment. So this is on check-in or at check-in for the appointment. Jason will show you this in more detail. But you can set this up so that it is giving you the answers to the questions that you need to then start your assessment. Of course, the patient would have to say this is what they want to do, and they'd have to choose this reason for visit. But with a little bit of education, you can point them to this complaint form and allow them to then sign themselves in. But what's really important, these are the elements: cough, fever, sore throat, body aches, shortness of breath. What's come up in some of the literature and research is that patients are experiencing a loss of a sense of smell or a taste. Others are having GI symptoms, and then every day people are talking about new things that patients have presented with. So it's really important that you stay up to speed on what it is that's being presented to your providers with this COVID-19. When you're documenting exposure, the real important here, I've done a lot of epidemiology in my past through AIDS epidemic and a few other things that have gone on since I've been in practice. And exposure details are really important. What's good to know here is that they got it at a family picnic because you need to give advice that those other people need to be seen or checked. Risk level, where they were. Example, New York City. I live in Pennsylvania, and I'm very close to New Jersey and New York, and those are kind of sealed off areas for us now. We're on lockdown as well. When they got this so that you could start the counting of symptoms and where they would be as far as their period of exposure and how far now symptoms are starting. And then anything else you could give about their exposure. Review of systems, nice and easy. You're going to collect the review of systems, anything else they're complaining of at that appointment check-in process. And then physical exam. Physical exam becomes interesting because it is truly what you can see with your conversation with the patient or what you can ask. Anything that you can visually see, you can document. So constitutional, patient looks ill, they're well nourished, things that you can see on camera. What is their respiratory effort? Are they struggling? Are they pale? Do they have any present rash? That psychiatric evaluation, person, place, time, you could do other questions as well. And then anything else that would come or apply to the reason for visit would be part of your physical exam. If you want to get a temperature, the patient says that they have a temperature of 102.4 for the last 2 days. I tend to put that over in the HPI just because that is their story. I have colleagues who actually have patients taking temperatures and holding it up, and the provider is actually reading off of the thermometer. It could get tough if they're using a glass thermometer, but some of these new ones are pretty good. If you have devices or other ways, you could use that. If the patient is reporting, it's hearsay, and what I mean by that is you have to document the patient's state. You cannot just put it, I wouldn't put it in vitals just because it is not something that you or your team measured. Thing to remember here is that you can enter the PE either by going through the system or you could dictate it in a block, and it's what you can observe. Now, on to the COVID-19, and you probably have seen these codes before, but it's really important that when you are assessing a patient for COVID-19, this is a respiratory system condition, and so your suspicions and the things that you're going to be collecting or are going to accompany it are going to be respiratory conditions. There are a number of codes, and as I said, this will be out there for you to get to on this slideshow as well as on the Success community. and on the knowledge articles, but acute bronchitis, J20.8, and in the past, you were using, or you were up until yesterday, the B97.29. Now, if you're submitting your bill before, you're submitting your charges to Medicare before the COVID-19 diagnosis comes back from the lab, you already use these two codes for acute bronchitis and other coronavirus as a cause of disease. Same with pneumonia. And once again, this more generic code for the coronavirus. Same with ARDS. If they present with acute respiratory distress syndrome, you'd use the J80 for ARDS with B97.29. If you are submitting anything with fever, cough, or other signs and symptoms, you would be saying the B97.29 and then whatever symptoms you have. If the patient says they had a direct exposure to somebody with COVID, a loved one, you could then use this exposure code Z20.828. And so these are the codes. As of yesterday, there is now a new code, U07.1, and this is the new COVID-19 as a causative agent code. It became active yesterday. It is in NGO at this time, so you can get it. You would be using this U07.1 in place of the B97.29 once you have lab confirmation. So you need to get that lab confirmation back before you can use the U07.1. It's also recommended that you make the COVID-19 code your primary or principal diagnosis, depending on what you're billing. And then you want to put other aspects of the patient's condition. Those are the secondaries. You want to use them. Reason is that this can be used for epidemiology in the future. This person came in and they have, respiratory syndrome, distress syndrome. They just had a fever and a cough. It's just giving you that additional information. So you want to use the principal, U07.1, and then put in any secondary conditions. Documenting of your plan for this patient, Jason's going to show you some of that, but it's no different than how you've done this in the NextGen Office system since you've been using it. Really, you're just doing an inpatient visit. Your patient's just on a camera as opposed to being in person with regard to your plan. To get to the end of this, there are new testing codes. Once you are collecting specimens, you can use the specimen 99000. A lot of people are sending their patients directly to these testing sites, and they're not doing that. But if you do that, you can use the 99000. And then the CPT code is 87535, and that is for this COVID-19 test that needs to be done. This code went into effect a couple of weeks ago, so you have that on your bandwidth or your tools to be able to code for that. There are other tests here. I'm going to get this to you. You'll see it, but you should not be using U001 or 002 if you are not running the test or incurring the cost. This is for those laboratories. But this has been out there. People are starting to talk about it, and people are asking if they can use this. If you're not the one doing the tests or incurring the cost, you cannot use these codes or bill for these codes. So E&M coding, another thing you need to do is you need to select your E&M code as you usually do, your office codes, and then your biller is going to need to change the location to telehealth, because it is a telehealth visit. So instead of the usual 11 or whatever area you went to, you would then put it as an O2 as the location, and then the modifier would be for a non-Medicare payer is a modifier of 95. So that is a very quick version of this, and I'm going to turn this over to Jason to then get into how to use the system and what's there for you. Jason?
All right. Well, thank you very much, Dr. Gary. We certainly appreciate all of that knowledge and insight. And thank you to everyone that has joined us today. Give me 1 second. I need to be able to share my screen. Let's see here. Dr. Gary, could you pass the ball to me as presenter in the meeting, please?
Got it. There you go.
Okay. Very good. Thank you very much. All right. So, well, folks, once again, my name is Jason Parke. Thank you all for taking time out of your day to spend a little bit of time with us here today. I will be taking you through some of the basics as far as how telemedicine works within NextGen Office. And there's going to be 3 key areas that I'm going to touch on. First is how you set up a telemedicine visit by scheduling the patient appropriately. We need to have the patient scheduled. Second will be how we go about actually doing the documentation and showing how that's almost identical to exactly what you're doing right now, with the exception of the fact that there's going to be a little camera that's open and a video panel. And then the third will be kind of talking about some of the customization that can be done within the system, which, well, we can cover obviously more in one-on-one training with any one of you at any time to be able to set up custom COVID-19 forms and anything else. So the first step to a telemedicine visit, once a patient is in the system, is to schedule them for what is called an e-visit. Now, you should all have e-visits enabled in your system, but if you don't, I'm just going to show you very quickly how you do that. So you go to Admin, and under Calendar Appointment Types here, within your location, you want to make sure e-visit is here. This is, you want to make sure this is enabled. And once again, please remember that you can always call customer service. You can always call in directly, and we'll be happy to train you on any of this. But this is meant to be kind of just a general overview. Once you have e-visit enabled there within your location, well, the patient calls in, and you decide you want to do an e-visit with them. Oops. Save that right there. We will go to the calendar. Let's just look at the day view today and go on down. And if I was to schedule an e-visit, it's once again identical to how you'd be normally scheduling a face-to-face in-person visit. Just click the time there and make sure you select the appointment type of e-visit. So this is really important, is that you do select e-visit. That's what will tell the system that when you are in the EHR to open the camera and initiate the telemedicine. So it's an e-visit. Or just like one of our patients here. So that's how we would schedule the e-visit. Now, your patients, in order to do the e-visit with you, do need to have access to the patient portal. They need to be set up and able to log into the patient portal. To set up access for the patient portal, first off, allows to just go to a patient's chart here. Patients, you can hit reset password right here from within their chart. That will allow a temporary username and password to be set up for them so they can log in with that. Instead, then pick their own username and password. And again, we do have training on how to help with all of this to set up access for your patients in their patient portal. All right. So the first step is just, once again, scheduling the patients for the e-visit. Now, once a patient is scheduled for an e-visit, I'm going to jump over here to the patient portal, and I'm going to kind of shift roles. Instead of being the front office staff that was then scheduling the appointment, now I'm going to be acting as the patient logging in to initiate the e-visit. So this is what your patients will experience on their end. So go to the patient portal. If they already have their account activated like we do here, we'll just log in. Otherwise, they could use that temporary username and password that I just showed you to activate their account. And as we log in, this is what the patients will see in the patient portal. Now, one thing to keep in mind is patient portal, it's accessible for your patients on any device. So this is what it would look like on a desktop or laptop. This is what it would look like on a tablet. So they could log in from, say, their iPad. they could even log in and do these telehealth visits from their iPhone, and it would look like this. So a single column view for the smartphone, 2-column view for the tablet, or the 3-column view here for desktop or laptop. Now, if we have an upcoming appointment, in this case, if I go back here to the practice management and I'm looking at the schedule, this patient has an appointment scheduled at 1:45 p.m. today in the practice management. That reflects for the patient over here in the patient portal. I have an upcoming appointment at 1:45. So if I'm pretending to be the patient here and I have my visit coming up, I'll go ahead and just touch on the tile right here, or click if I'm on my laptop. What this is going to do, it's going to then take us through our virtual check-in. Now, these different steps, these 13 steps here, are designed to capture the entire subjective portion of the encounter note. The reason for the visit is going to be your chief complainant HPI. We have a review of systems, allergies, immunizations, medical, family, surgical, and social histories. The idea here is that the subjective portion of any encounter note is quite simply just the patient telling us about themselves. So the idea with the virtual visit is, why not let them do that, and why not actually require them to do that before they start the visit, leading to less documentation for the physicians. So if I'm this patient, I can just jump right here. And one thing to mention very briefly is that these are the default steps set up in the system. If you would like to reach out to customer service, we can show you how to customize any of this. So if you thought, this is too much information, I don't want my patients to have to go through all of this as far as the virtual check-in, you can trim this down, you can remove things. If you have any custom forms that you wanted them to be able to fill out, if you create those in the system, those can be brought in here. So you can customize this virtual check-in to be whatever you'd like. So reason for the visit, let's start here. And now I'm going to just type in a few letters and say coronavirus, right? Maybe the patient's doing a telemedicine visit because they think they have coronavirus. This form, and just as kind of a little side note, I'm going to be showing you some stuff that I've customized in my account. Specifically, this form right here, this chief complaint form, is one of the customized forms that I've created. I did so by modifying the respiratory cough chief complaint form that's existing in the system. And we'll be more than happy to teach you and empower your staff with the knowledge as far as how to customize and set up your own chief complaint forms if you'd like. So if I was to just select that, or just use one of the ones that is built in, right? The patient just types in a few letters and it's going to pull up that form. So if we select coronavirus assessment, COVID assessment, at this point we're just going to simply answer these questions. Do you have a cough? Yeah. Had it for a couple days. Coughing up any phlegm? Yes. It's kind of thin and yellow, we'll say, maybe a little white. Yes. Or I say no blood. Yes, fever, 102. And the reason I'm filling this out here is because I want you all to be able to see that what is filled out here as a part of this form in the patient portal by the patient will subsequently populate into the EHR. And if any of you folks are using the portal currently, this is the exact same process that your patients would have been going through if they're doing the virtual check-in for an upcoming visit, for a face-to-face visit, right? So there's nothing different for your patients if they've been doing this already. Save that. Now they can go ahead and go on down here, do the review of systems. And say mark all no. So documenting by exception, right? Everything is normal except fatigue, fever, aches. And you can see how it's very touch-friendly. So if your patients are on a tablet, say an iPad or a smartphone, I'm just going to touch through here, document any positives, hit save, and just move on to the next step. And I'm not going to go through each and every one of these steps just in the interest of time here today, but the idea is that patients using the previous and next buttons will be able to move through, again, filling out the entire subjective portion of their note. Free text, dictate whatever we needed to do, save, and at the end of the virtual check-in process, they'll say complete check-in. And this is, if they did skip any steps, it's going to show with the green checks. These are what they did fill out. In the interest of time, I skipped all of these here, and I'm going to hit complete check-in process, and that will then open a camera. Hello, folks. My name is Jason. And so this is what the patient will see. Now at this point, what I'm going to do is I'm going to jump over to the NextGen Office EHR. So that process we just went through there was basically what the patient would do, filling out all of their information, doing the virtual check-in. And now I'm going to go over to the NextGen Office EHR. So this should look familiar to almost all of you, right? If you're using the EHR, this is just your standard dashboard. Now, the only kind of little difference here is that we have Mr. Gary here, scheduled for an e-visit at 1:45. If you remember back in the patient portal, the patient had done the virtual check-in and filled out the steps for their upcoming e-visit at 1:45. Now, as the provider, what you're going to do is you're going to go ahead and touch on the time over here, just like you would for a typical in-person face-to-face visit. Touch the time, and that takes us directly into a note. So this is going to look a little strange. It's I'm doing an e-visit with myself right now, so it's kind of mirroring back and forth. So I'm kind of on both sides here. But in a typical situation, this would be the provider on the left, the patient on the right. Now, if I scroll on down a little ways, this should also be very, very familiar to all of you providers. It's the exact same SOAP note. So nothing is different with regards to documentation, except for the fact that you can always scroll back up to the top and you have this camera with the video conference going on with your patients up top here. Now going down, if we look down here in the subjective, patient notes. This is what the patient typed in the patient portal. This is the chief complaint and then the related HPI that the patient entered into the portal. The review of systems, the patient entered into the portal. So once again, all the subjective information the patient filled out in the patient portal populates directly into the subjective portion of our SOAP note over here. Now, if we go on down, the rest of this will be up to you to document. So vital signs, as Dr. Gary mentioned, if the patient happens to tell you something about their vitals, say, I've been monitoring at home, that would be subjective information. So that would be probably a good idea that you could go up top and maybe we wanted to just go here, enter some pretext either by typing or patient who reports that they have been monitoring their temperature at home using a digital thermometer, and they say that they peaked at 103.7 yesterday at 6 p.m. period. You can dictate. So capturing that information, if the patient's telling us about themselves, once again, it's going to be subjective. And that said, if the patient happens to have a, say, digital thermometer and they wanted to take their own temperature, get a reading, display it to the camera, that would be a good way for you then to be able to go down and capture vitals just by scrolling down, touching right there, or as you all know, you can go into vital signs here under objective and capture your vitals just as you would with a normal in-person visit. Obviously, you're not going to be capturing BP, but if we wanted to go down and say temperature, 99.7, if the patient happens to have a digital scale and they wanted to jump on the scale and share that with you, you could do that as well. I mean, it's up to you how much or how little that you wanted to capture. Then going back to the encounter screen here, remember the video cameras always open up top. You can always go back and see your patient and just kind of scrolling down on the screen. Under physical exam, document everything there. Typically, what we see providers doing with the telemedicine visits is just simply dictating or typing something that they observe, right? Or as you are currently doing, you can use any of your blueprints. You can use the actual touch phrasing in the physical exam itself. Now, if I go down to the diagnosis section, we have codes suggested, and these are the codes associated with the chief complaint form. I also created a COVID panel over here with common codes that Dr. Gary had been kind enough to share with us earlier. Just put a bunch of these codes in here so it's easy to find these. This is something that we will show you how to customize and set up in your system as well, is to create your own custom panels here. I can just tap, 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 grab a few of those, jump on down to the plan. And just like you're currently doing, you know how to prescribe. I'm sure all of you know how to prescribe in the system. You can order labs. Going down here now to, say, care plan. You can create a care plan. I just created one very quickly off the cuff here for coronavirus. Stay home, wash your hands frequently. Clearly, you can see I'm not a doctor, so that would be my recommendations. But the idea is that you know, anything that you would be telling your patients as far as the care plan, what you want to do, this is all highly customizable. So once again, you can use whatever you want. We'll show you how to set that up in the system. Patient instructions now, we do have patient instructions built in. So if I was to touch right there, the instructions are suggested based off the diagnosis. If you're using the Elsevier patient instructions, these can be, and these will be actually, published to the patient portal, so they'll be able to see these after the visit when they're looking at their visit summary. Then, just wrapping up the note, what we're going to do is jump back to procedure coding right here. And as Dr. Gary mentioned, with parity laws in most states now, and again, it is different state to state, but we would recommend you check with your payers locally. We're going to build this as a 99213 here. And then if you're billing to the commercial payers, you would use that 95 modifier. If you're billing to Medicare, you want to make sure you have the place of service, once again, as 02, which will be modified in the practice management side. And just like with a normal visit, you would hit generate PM billing. This pushes everything directly back and places it in hold in the practice management side of the software, waiting for the biller then to review, scrub, and submit. So as we went through here, folks, it's quite literally identical to a face-to-face visit. The only difference is that you have this camera up top here where I'm looking at myself in two different screens. But aside from the camera up at the top, your documentation is absolutely identical. It's just a matter of documenting what you're seeing. And one tip that I would recommend, and I'm not sure if you folks are using this or not by now, I'm sure that most of you are, this button right here, Save as Blueprint, incredibly powerful tool within the system in terms of helping to speed up visits, helps with efficiency regarding documentation. If I had just done this visit for a patient, this is a very typical COVID-19 assessment that we did, and you know, everything is pretty straightforward. And I think, you know, this is something I'm going to do again. I could hit Save as Blueprint. Any of what we've just documented. And this is something that you can use for any of your visits, not just COVID-19, not just telehealth, but any of your visits. You know, when we return back to the new normal in time, I would recommend that you all keep in mind that you can save any notes that you do, any or all of it, for future use for any other patient. So if I decide, you know, I don't really want to save some of this subjective information because that's the patient telling us about themselves. We want them to do that through the portal. I'm going to deselect those, but then say, you know, the diagnoses, the procedures, the care plan, the patient instructions, physical exam findings, etc. We can save all of this just simply by selecting the body system, giving it a name and a description, so that next time we're going in and doing a visit with the patient. So let me go back here to the dashboard, and let's say now, instead of we're done with our visit with this patient, we're going to see our next patient here. Touch right there. Brings us into the note. I could just simply start this by going up top, going to Grand Central. Grand Central is where all of these blueprints exist. Go on down to respiratory. Load COVID-19 telehealth like that. Now keep in mind, if this was a telehealth visit, the patient would have already filled all their information, just like we showed you a few minutes ago. They would have filled that out in the patient portal. But now, as I come in and I would review what the patient filled out in the portal, I could then load the physical exam, the diagnosis, the procedures, the care plan, patient instructions, follow-up, anything else from this blueprint just by hitting import at the bottom and then preview. So the blueprint tool will be really helpful in terms of increasing efficiency with regards to documentation. and that is the telehealth process within NextGen Office. So the important takeaway for all of you folks is that it's going to be exactly the same as you're currently doing. The only difference is that, number one, you need to schedule the patient for an e-visit as opposed to a typical visit like a follow-up or new patient or what have you. And then number two is that from there, you can go through and do all of your notes exactly as you would just by, well, watching the patient in the camera up top here, using blueprints, using custom forms, and documenting appropriately.
Great. Okay. I'm going to try to steal from you again, try to get the screen back. Can you give it back to me?
Sure thing. Let me pass the ball right back to you.
So we have a number of questions here, and I'm going to address some of them. So I did get, thank you, and I'm going to thank you for the input. I did get a few comments about the use of the 95 and 11 for Medicare. I'm going to check on that, and I will be sending out an email, or when we send out this presentation PowerPoint, I will have corrected it there. But from what my billers told me late last week as I was preparing this, it was the use of the O2. So I will clarify that. So a few of you brought that up. So thank you. I'm not going to call out your names. But let's a few other things that came up. Oops. Let's see here. Can we get my screen on here? So another question that came up, I just want to make sure before we end this, and I'm not going to be able to see it if I have mine open. I'm going to go through this first, and then I'll answer a few of the questions, and we probably won't be able to get to all the questions, but we will do a Q&A, and we will go from there. We'll send out a Q&A or, out to the group that's here today. But the next step, so you saw this presentation today. We hope that it was beneficial for you. If you are currently using the Premium Patient Portal, you have it, and you're using the e-visit functionality, but you're not sure about any of these various elements or setup or anything like that, please reach out to your customer support person or the customer support team, and they will walk you through it. If you have the Premium Patient Portal, but you are not using it, you're like, I've never activated or done it, once again, reach out to customer support, and they will help get you started on the road. And if you don't currently have the Premium Patient Portal and you would like to start using this functionality, you can reach out to your sales representative. If you don't know who that is, if you just send an email in, somebody there will then reach out to you and talk to you about next steps for getting involved in this. Some of the questions that came up on this, I'm trying to figure this, get this opened here. There we go, I can get to it now. One of the questions that came up was about using the office visit codes, but they also brought up the fact that, they thought they were supposed to be using the 99421 through 99423. That is for the patient-initiated e-visits. If you use that, you are going to get paid minimally. The patient is supposed to be doing that and you're not really scheduling them for an appointment. That is more of the patient doing an encounter with you or initiating a conversation. You want to use the office codes, the 9920X through 9921X codes to be able to get a telehealth visit. That is the way to go with this. And that will give you the payments that you're currently getting for an in-office visit. So do not use the 99421 through 423. That is for those smaller visits, and that's not going to get you paid for what you're doing. You're documenting, you're initiating a visit, you as a practice and provider, and so you should be doing a regular telehealth visit, and going from there, you should get paid for a regular visit. Once again, we are out of time. Sorry about that. There are a number of questions here. we are going to be doing a follow-up email on this, and we will send it out to everybody, and we will go from there, okay? And you'll have information, you'll be able to get further information about what to do next. But once again, the thing to remember, if you have it and you're using it but you're not using it well, or you have questions, call customer support. If you have the premium patient portal but you've never done the e-visit functionality or the virtual visit functionality, call customer support and they will get you started. And if you don't have it and you want to get started, reach out to sales, NGO sales team at nextgen.com, and they can put the requisition or they can get you started on the path to putting this into your practice. Okay, I think we're at the top of the hour. I know you're all busy. And I'll let you go and have a great rest of the day and be safe. And reach out to us if you have any questions. We're also going to be doing additional information for you on the success community and or knowledge articles that you can get to from the system. And we'll be advertising to you other sessions that we're going to be doing to help with keeping you up to speed on all this. So have a blessed day and take care.